Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, if you were asked what is the drug of choice for juvenile myoclonic epilepsy, the drug of choice for juvenile myoclonic epilepsy is valproate. But this is actually avoided in women of childbearing age. So the alternative for them is we can use either levetiracetam or we can use lamotrigine at the first line. But the problem here is lamotrigine can exacerbate myoclonic seizures. Okay, and actually levetiracetam is actually treatment of choice in pregnancy with juvenile myoclonic epilepsy. Thank you for watching.
Thank you and thank you for watching.